Hello everyone, it's Sophie here again with another video for you. I hope you are all well. Today's video is all about interdental cleaning and how we can use that effectively in our daily routine. If you'd have seen any of my previous videos, you will have heard me say that we should be brushing twice a day for 2 minutes, and I've done a video all about toothbrushing and how you can be using that effectively. But today it's going to be all about interdental cleaning, and the reason why we recommend daily interdental cleaning is because even though all the adverts tell us they do and the packaging tells us that they do, whatever toothbrush you have, the bristles will not get all the way in between the teeth, and so it's really easy for plaque to get stuck in those spaces, food to get stuck, and if we're not careful, those areas can then become inflamed, which means the gums get red, they can get a bit puffy, and they can bleed when we brush them. And so we need to be using something as well as our toothbrush to get into those spaces, to break up the plaque, to move away any food debris, and to keep those spaces clean. And so there's a few different options we can use for doing that. One of the most common options would be floss, and there's a few different ways that you can use that, but also things such as interdental brushes, like TP brushes is a common brand. They can be quite easy to use in comparison to floss. So I'm going to show you all the methods that we've got on offer to be using between our teeth and how you can be using those to keep your mouth nice and healthy. So first of all, I'm going to show you how to use floss. A few people have commented on how far back this mouth goes. Obviously we can't dislocate our jaws to clean our teeth, although that would probably make things a little bit easier. But just for the purpose of showing you what to do, this model is a little bit easier. So in terms of floss, I tend to recommend tape floss, and that's because of the shape of it. I'll just get a little bit out here. So as you can see, this is flat in shape. Often flosses can be like a thread, like a piece of cotton, but this tape tends to be a little bit more forgiving, and that's because it's got a larger surface area, so if you are to slip, it doesn't tend to cause so much damage. Thread can kind of cut the gum a little bit more and can make an area sore. Also, tape tends to have a coating on it that often tastes minty, but it gives it a softness, so it tends to glide down the teeth a little bit more easily, and so that's why I would recommend tape. I'm just going to get a longer piece because that piece wasn't long enough to show you. The best way to use floss is to wrap it around your middle finger. So both fingers, get it wrapped around your middle one, and then what you want to do is pinch between your thumb and first finger. I'm just going to show you around these teeth at the front, and what you want to do is get the floss to go between the teeth and then curve it up and down each tooth. You'll notice these teeth move. Hopefully your teeth don't move when you do this. But you just want to curve it up and down the teeth and then move along to the next one. The reason why we say to curve around the tooth is because if you saw my toothbrushing video, I also talked about it there. Your teeth are curved in shape. They're not straight lines. They are curved lines. So what you want to do with any kind of motion that you're doing around the teeth, whether it be brushing or flossing, is you want to curve around the shape of the tooth so that anything that's touching it, like plaque or a bit of food, will get moved out of the way. And you just want to move it along the teeth all the way to the back if you can. A lot of people tend to struggle when they get to these back teeth. So one thing that you can use if you like to use floss is to use something like this. This is a floss pick or a floss harp, lots of different names for it. This is quite a long handled one. You can get them a lot shorter than this and different variants in terms of shape and angles and things, but this has just got a piece of the tape floss on, and you just use this in exactly the same way, but because you've got a handle it gives you a bit more control. So you just want to move it between those teeth at the back and work your way around the mouth. So some people tend to prefer these, and they are a little bit easier to use. So that's how you tend to use flossing, and we would say to do that every day, either with a piece of tape or a floss handle. So the next option that we have for interdental cleaning are interdental brushes. Now this is probably the method that I prefer and I think is easier for people to use. There are places for floss to be more necessary, so if you've got a gap that's very tight, a very tight contact point, then floss is probably going to be your best option if you can't fit a brush through. But in terms of brushes, they tend to look like this. So this is an angled TP. They also do them in shorter handles, and the colour is the size of the brush. So these brushes go from this teeny tiny pink size to, if I show you the largest size, goes up to this size. So any kind of gap that you have, these brushes will cater for. You can see the size difference there. So any kind of gap, these will fit. And what you want to do is find a brush that fits the gaps well. The way that you know a brush is fitting well is if you get a little bit of friction as you move the brush through the teeth. So what you want to do is get the brush to go into the space and move it back out. So this one, as you move it through, you can feel it's touching both sides of the tooth and you're getting a bit of friction. If it's too small, like this one will be, it goes kind of right through really easy and you can't really feel that it's brushing anything. So if I use this yellow one, it moves much more easily between the teeth. So that's the easiest way to use those. You can also go from the inside, so if you're looking at the top teeth, what people tend to find is that they get to kind of these back areas here and they can't get the brush through this way. So what I recommend people to do is to open your mouth as wide as you can and go through that way and kind of move it round that way. The reason why it's often hard on the cheek side is because your cheeks have got quite strong muscles in them, and so they will push the brush so that you can't get it to go through the teeth. But that's the easiest way to use those. There's lots of different variants of these. In terms of smaller sizes, they also do these like rubbery style ones. I know there's Wisdom and Pixters also make these as well. So there's lots of different ones out there on the market. These ones are tapered and like a rubbery material. So if you have sensitive gums or you find that your gaps are generally quite small, these ones are tapered so it tends to fit numerous sizes in one. And you just basically push this as far between the teeth as it will go and kind of move it around the teeth that way. So that's how to use the interdental brushes. So I'm just going to show you how to be cleaning bridge work. So bridges are quite a common way to fill gaps and missing teeth. The way that they work is that you have two teeth either side, so two of your natural teeth, and then you've got a gap between, and what happens is the dentist attaches a floating tooth to these teeth here. So you have your two natural teeth and then a floating tooth in the middle, and what happens is that tooth in the middle has a gap running all the way underneath. So most people with bridge work will complain that things get stuck underneath or they can't clean it thoroughly enough, and a really easy way to be cleaning bridge work is to use something called super floss. Super floss looks like this. It's basically like a thread of floss, but it has this spongy bit to it. And this spongy bit we want to get to run underneath the floating bit of the bridge. Now it has a plastic end here that's a bit thicker, and this is the bit that we use to thread underneath. So you want to get to one side of the bridge, get the spongy bit in the centre of your bridge work and get it to clean the one side, and then run it underneath and clean that side. So you're basically running this floss all the way underneath this bridge work. Now you can also use interdental brushes, so you could use a little TP brush to run underneath, but what I tend to find my patients tell me is that their gum underneath here can be quite sensitive. So this is a little bit softer, and so it can be a little bit more gentle on that gum work. So if you're comfy to, use a little brush, but super floss can be a really easy way to keep that clean. Other methods that you can use for bridge work are water flossers. I'm just going to adjust my camera here This is a water flosser or a water pick. Basically it works by having a reservoir here that you fill of water, and then you use this handpiece as a little jet wash, and what you do with it is you spray the water underneath the bridge work. You can use it between the teeth as well, so if you've got natural teeth you can use it to spray in between each tooth, and this can be a great option if you have dexterity issues. So if you struggle with holding something like a little brush or floss for any kind of cleaning, this could be good for you, but it is also useful for bridge work, for cleaning underneath that gap. It's a little bit pricier, but it can be a great option for those who struggle with using their hands. So if you're brushing twice a day and you're using your interdental cleaning every day, you are putting your mouth in a much healthier position. If you've never used any of this stuff before, then I can recommend getting yourself into a good routine of brushing twice a day and using these interdental aids. If you've never used any of these things before, or you're quite sporadic with your interdental cleaning, you may well find that your gums will bleed. And that's because if you're not regularly using an interdental aid, there may well be plaque present there, or food debris, and inflammation may be there. So the first few times that you do this, you may find that your gums will bleed, but that should settle after a week or so of a good routine. If you're finding that the bleeding is carrying on, it may be a sign of an underlying issue such as gum disease, or if you do have a health condition already, that can sometimes link with bleeding gums. So always make sure that you're seeing your dentist regularly. Most dentists would recommend seeing you every 6 months. Some may say a year, but if you do have things like gum disease or anything that could affect the health of your mouth, it may be more regular than that. So make sure that you're booked in with a dental professional regularly. We go through this stuff with our patients on a regular basis. I'm the kind of hygienist that gets the brushes out every time I see you, check your sizes, check your technique to make sure that everything is good, and that's what we should be doing regularly to keep our mouths healthy. So if you haven't ever seen anybody like myself before, get yourself booked in. I'm more than happy to see patients who've done this stuff before, or maybe they haven't ever done anything like this before. I'm more than happy to see you. So get yourself booked in if you need to, but give this stuff a go. Give yourself a really good routine so that your mouth has the chance of being as healthy as possible. Brush twice a day, get your interdental cleaning done every day, and I can guarantee that your mouth will thank you for it. Until then, stay safe, stay well, and we'll hopefully be seeing you in the clinic soon.